Pass your exam with mental health patient rights practice. Question 1. Which statement made by the patient demonstrates an understanding of the effective use of newly prescribed lithium to manage bipolar mania? Select one that doesn't apply. Option A. I remind myself to consistently drink 6 12-ounce glasses of fluid every day. Option B. I discussed the diuretic prescribed by my cardiologist with my psychiatric care provider. Option C. Lithium may help me lose the few extra pounds I tend to carry around. Option D. I take my lithium on an empty stomach to help with absorption. The correct answer is option C. Lithium may help me lose the few extra pounds I tend to carry around. Rationale. Question 2. When assessing a patient with generalized anxiety disorder, GAD, which symptom would the nurse most likely observe? Option A. Flashbacks. Option B. Excessive worry. Option C. Hallucinations. Option D. Compulsive behaviors. The correct answer is option B. Excessive worry. Excessive worry is a characteristic feature of generalized anxiety disorder GAD. Patients with GAD experience persistent and excessive worry about various aspects of their life, such as work, health, or family. Question 3. Gilbert, age 19, is described by his parents as a moody child with an onset of odd behavior at age 14, which caused Gilbert to suffer academically and socially. Gilbert has lost the ability to complete household chores, is reluctant to leave the house, and is obsessed with the locks on the windows and doors. Due to Gilbert's early and slow onset of what is now recognized as schizophrenia, his prognosis is considered: Option A. Favorable with medication. Option B. In the relapse stage. Option C. Improvable with psychosocial interventions. Option D. To have a less positive outcome. The correct answer is option D. To have a less positive outcome. The scenario describes Gilbert as having an early and slow onset of schizophrenia, which typically indicates a less positive prognosis. Individuals with such presentations may experience more severe symptoms and. Question 4. James is a 42-year-old patient with schizophrenia. He approaches you as you arrive for the day shift and anxiously reports, "Last night, demons came to my room and tried to rape me." Which response would be most therapeutic? Option A. There are no such things as demons. What you saw were hallucinations. Option B. It is not possible for anyone to enter your room at night. You are safe here. Option C. You seem very upset. Please tell me more about what you experienced last night. Option D. That must have been very frightening, but we'll check on you at night and you'll be safe. The correct answer is option C. You seem very upset. Please tell me more about what you experienced last night. Response C is the most therapeutic as it shows empathy and encourages the patient to express their feelings and share more about their experience. By actively listening and inviting the patient to talk, the nurse. Question 5. Which activity is most appropriate for a child with ADHD? Option A. Reading an adventure novel. Option B. Monopoly. Option C. Checkers. Option D. Tennis. The correct answer is option D. Tennis. Children with ADHD often struggle with sustained attention, impulsivity, and hyperactivity, making it essential to select activities that align with their neurological needs while minimizing frustration. Tennis D. Question 6. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A. Monitor the patient's vital signs frequently. Option B. Keep the patient distracted with group-oriented activities. Option C. Provide the patient with frequent milkshakes and protein drinks. Option D. Reduce the volume on the television and dim bright lights in the environment. The correct answer is option B. Keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable. Providing nutrition, such as milkshakes and protein drinks. Question 7. When assessing a patient with major depressive disorder, which symptom would most likely be observed? Option A. Euphoria. Option B. Anhedonia. Option C. Increased energy. Option D. Racing thoughts. The correct answer is option B. Anhedonia. Anhedonia, the inability to feel pleasure in activities that were once enjoyable, is a hallmark symptom of major depressive disorder. Patients with major depressive disorder often experience a pervasive feeling of. Question 8. Tammy, a 28-year-old with major depressive disorder and bulimia nervosa, is ready for discharge from the county hospital after 2 weeks of inpatient therapy. Tammy is taking citalopram, Celexa, and reports that it has made her feel more hopeful. With a secondary diagnosis of bulimia nervosa, what is an alternative antidepressant to consider? Option A, fluoxetine, Prozac. Option B, isocarboxazid, Marplan. Option C, amitriptyline. Option D, duloxetine, Cymbalta. The correct answer is option A, fluoxetine, Prozac. Fluoxetine Prozac is a suitable alternative antidepressant for TMI due to its approval for the treatment of bulimia nervosa. It belongs to the selective serotonin reuptake inhibitor SSRI class of. Question 9. For a patient with obsessive-compulsive disorder (OCD) who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A, exposure and response prevention. Option B, dialectical behavior therapy. Option C, family therapy. Option D, interpersonal therapy. The correct answer is option A, exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 10. A nurse is reviewing prescriptions for a patient with major depression at the county clinic. Since the patient has a mild intellectual disability, the nurse would question which classification of antidepressant drugs. Option A, selective serotonin reuptake inhibitors. Option B, monoamine oxidase inhibitors. Option C, serotonin and norepinephrine reuptake inhibitors. Option D, all of the above. The correct answer is option B, monoamine oxidase inhibitors. Monoamine oxidase inhibitors are less suitable for patients with intellectual disabilities due to the need for dietary restrictions and close monitoring. These restrictions can be challenging for patients with mild. Question 11. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A, encourage the patient to talk about their feelings. Option B, use a firm, authoritative approach. Option C, stay with the patient and provide a quiet environment. Option D, suggest the patient watch TV to distract themselves. The correct answer is option C, stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support, encouraging the patient to talk. Question 12. Which behavior is consistent with therapeutic communication? Option A, offering your opinion when asked to convey support. Option B, summarizing the essence of the patient's comments in your own words. Option C, interrupting periods of silence before they become awkward for the patient. Option D, telling the patient they did well when you approve of their statements or actions. The correct answer is option B, summarizing the essence of the patient's comments in your own words. Summarizing the essence of the patient's comments in your own words is a key aspect of therapeutic communication as it demonstrates active listening and understanding. It shows the patient that their words have been. Question 13. Which characteristic presents the greatest risk for injury to others in a patient diagnosed with schizophrenia? Option A, depersonalization. Option B, pressured speech. Option C, negative symptoms. Option D, paranoia. The correct answer is option D, paranoia. Paranoia in patients with schizophrenia can lead to aggressive behaviors, including violence, which poses a significant risk of injury to others. Individuals experiencing paranoia may perceive others as threats and. Question 14. Which approach involves surgically implanting electrodes into specific areas of the brain to stimulate regions identified as underactive in depression? Option A, transcranial magnetic stimulation. Option B, deep brain stimulation. Option C, vagus nerve stimulation. Option D, electroconvulsive therapy. The correct answer is option B, deep brain stimulation. Deep brain stimulation is a treatment approach that involves the surgical implantation of electrodes into specific areas of the brain to stimulate regions identified as underactive in depression. This method aims to. Question 15. When using therapeutic communication with a withdrawn patient who has major depression, an effective method of managing the silence is to. Option A, engage in a quiet meditation. Option B, ask simple questions even if the patient will not answer. Option C, use the technique of making observations. Option D, simply sit quietly and leave when the patient falls asleep. The correct answer is option C, use the technique of making observations. Using the technique of making observations is an effective method of managing silence when communicating with a withdrawn patient who has major depression. This approach can encourage the patient to engage and feel. Question 16. Which of the following is a common side effect of benzodiazepines prescribed for anxiety? Option A, insomnia. Option B, weight gain. Option C, drowsiness. Option D, increased appetite. The correct answer is option C, drowsiness. Drowsiness is a common side effect of benzodiazepines prescribed for anxiety. Benzodiazepines work by depressing the central nervous system, which can lead to drowsiness as a side effect. This sedative effect is. Question 17. Carolina is surprised when her patient does not show for a regularly scheduled appointment. When contacted, the patient states, "I don't need to come see you anymore. I have found a therapy app on my phone that I love." How should Carolina respond to this news? Option A. That sounds exciting, would you be willing to visit and show me the app? Option B. At this time, there is no real evidence that the app can replace our therapy. Option C. I am not sure that is a good idea right now, we are so close to progress. Option D. Why would you think that is a better option than meeting with me? The correct answer is option A. That sounds exciting, would you be willing to visit and show me the app? Carolina's best response is A. That sounds exciting, would you be willing to visit and show me the app? Because it demonstrates openness, curiosity, and a patient-centered approach. By validating the. Question 18. Substance abuse is often present in individuals diagnosed with bipolar disorder. Laura, a 28-year-old with a bipolar disorder diagnosis, chooses to drink alcohol instead of taking her prescribed medications. The nurse caring for this patient recognizes that. Option A, anxiety may be present. Option B, alcohol ingestion is a form of self-medication. Option C, the patient is lacking a sufficient number of neurotransmitters. Option D, the patient is using alcohol as a coping mechanism. The correct answer is option B, alcohol ingestion is a form of self-medication. Individuals with bipolar disorder may turn to alcohol as a form of self-medication to cope with their symptoms. This behavior is often seen as an attempt to manage mood swings and alleviate distress. It is important. Question 19. Which response demonstrates accurate information that should be discussed with the female patient diagnosed with bipolar disorder and her support system? Select the incorrect one. Option A, remember that alcohol and caffeine can trigger a relapse of your symptoms. Option B, due to the risk of a manic episode, antidepressant therapy is never used with bipolar disorder. Option C, it's critical to inform your healthcare provider immediately if you are experiencing sleep disturbances. Option D, is your family prepared to be actively involved in helping manage this disorder? The correct answer is option B, due to the risk of a manic episode, antidepressant therapy is never used with bipolar disorder. In managing bipolar disorder, it is vital to educate the patient and their support system about triggers like alcohol and caffeine, the significance of good sleep, and the need for family involvement. However, Question 20. April, a 10-year-old admitted to inpatient pediatric care, has been getting more and more wound up and is losing self-control in the day room. Timeout does not appear to be an effective tool for April to engage in self-reflection. April's mother admits to putting her in timeout up to 20 times a day. The nurse recognizes that. Option A, timeout is an important part of April's baseline discipline. Option B, timeout is no longer an effective therapeutic measure. Option C, April enjoys timeout and acts out to get some alone time. Option D, timeout will need to be replaced with seclusion and restraint. The correct answer is option B, timeout is no longer an effective therapeutic measure. The correct choice is B because the scenario clearly demonstrates that timeout has lost its intended therapeutic effect for April. The key indicators are her increasing agitation and loss of self-control in the day. Question 21. Which intervention is particularly well chosen for addressing a population at high risk for developing schizophrenia? Option A, screening a group of males aged 15 to 25 for early symptoms. Option B, forming a support group for females aged 25 to 35 with substance use issues. Option C, providing coping skills information to a group aged 45 to 55. Option D, educating parents of developmentally delayed 5 to 6-year-olds on early intervention importance. The correct answer is option A, screening a group of males aged 15 to 25 for early symptoms. Screening males aged 15 to 25 for early symptoms of schizophrenia is a well-chosen intervention as this age group is at a higher risk for developing the condition. Early identification can lead to timely treatment. Question 22. Which assessment question asked by the nurse demonstrates an understanding of comorbid mental health conditions associated with major depressive disorder? Select one that doesn't apply. Option A. Do rules apply to you? Option B. What do you do to manage anxiety? Option C. Do you have a history of disordered eating? Option D. Do you think that you drink too much? The correct answer is option A. Do rules apply to you? Questions about anxiety management, disordered eating, and alcohol use are relevant to identifying comorbid conditions with major depressive disorder, but the question "Do rules apply to you?" does not directly. Question 23. For a patient diagnosed with borderline personality disorder exhibiting self-harming behavior, which therapeutic approach is most appropriate? Option A: dialectical behavior therapy. Option B: psychoanalysis. Option C: supportive therapy. Option D: pharmacotherapy. The correct answer is option A: dialectical behavior therapy. The most appropriate therapeutic approach for a patient diagnosed with borderline personality disorder exhibiting self-harming behavior is dialectical behavior therapy (DBT). DBT is specifically designed to address. Question 24. A patient with major depressive disorder is being treated with electroconvulsive therapy (ECT). The nurse should monitor the patient for which common side effect? Option A: memory loss. Option B: hypertension. Option C: weight gain. Option D: hyperglycemia. The correct answer is option A: memory loss. Memory loss, especially short-term memory loss, is a common side effect associated with electroconvulsive therapy (ECT). During ECT treatment, the electrical currents passed through the brain can disrupt short-term. Question 25. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client: she is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as option A: moderate, option B: severe, option C: mild, option D: non-existent. The correct answer is option B: severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in